The combination harvesting of scalp and body hair and implantation. This is the chapter number 31 in Practical Guide to Hair Transplantation. Overview of the chapter, the introduction, rationale of combination grafting, history of combination grafting, advantages of body hair follicles, prerequisite for combination grafting, indications for scalp and the body combination grafting, contraindication of combination grafting and the technique, and the final is the conclusion. So key points of the chapters are the high grade of baldness requires the large number of grafts for coverage and scalp donor area may not be sufficient. Non-scalp donor hair follicles from beard, torso and extremities can fulfill the deficiency of the supply. The improved technique and the instrumentation of FUE have made harvesting of body hair follicle possible and better quality of graft harvesting. The hair characteristics vary, but with the precise planning and combination of scalp and body hair can complement each other and they will look natural. The body hair along with the scalp hair follicles can be used as in primary procedure and as a secondary procedure to previously transplanted scalp hair to augment the existing transplanted density. Means it can be done in a primary case, means first time, and it can also be done in the second as an additional procedure. Never transplant beard hair follicles alone in one area as they stand out and look unnatural. The beard hair are thicker and they are curly in comparison to scalp hair. So their visual density looks more than that of the scalp hair, while the body hair other than the scalp hair are thinner. The body hair thickness after transplanted remains unchanged, but they may become longer than that of their original length. So the objective of hair transplant is basically to restore, to rejuvenate. We restore the identity, and identity is restored by the number of hair, the volume of hair, and how aesthetically they are implanted. This restores the identity of the person, thereby the person get rejuvenated. That's our aims and objective of hair transplant. This is high grade of baldness 7 using the hair patch. Underwent 4 times of 4 sittings of hair transplant. Now he looks happy and the look is natural. Similarly, is again advanced grade of baldness and he is so happy. His life has changed. That is our motto of doing the hair transplant. We all know that limitation of hair transplant procedure is there is a discrepancy between the demand of the recipient area and the supply. Means the recipient area is the larger, they need much more graft, while the donor area, scalp donor area supply is limited. So if we calculate in the high grade of baldness, the total bald or balding area of the scalp roughly is around 300 square centimeter in high grade of baldness, or we can say this area from mid frontal point to the crown area means upper border of the occipital fringe permanent zone is almost 300 square centimeter, and we can divide roughly into three zone: front, middle and back, means the frontal area, mid scalp area, crown or the vertex. I have given a very simple concept of dividing scalp balding area or temporary area in by forefinger, roughly forefinger, front forefinger, middle forefinger and the back forefinger. That's what you can see here. So one third and one third, and one area is 100 square centimeter. Normal density we consider is 80 to 100 gram per square centimeter. And if you want to give the density minimum which is acceptable, which gives you reasonable coverage is 25 to 30 graph per square centimeter and the area is 300, so we will need 7,500 to 9,000 grafts to cover the entire scalp balding area. But we know that occipital area means the scalp donor area can supply us 5 to 6,000, sometimes maybe little more, depending upon the characteristics of the available donor area. So there is always a deficit of 2,000 grafts and the demand is for the demand. So from where to get it? So for that we can take non-scalp donor area like beard and chest and we can combine them, and that is the meaning of the combination grafting. In this we scalp hair follicles are mixed with the body hair follicle. This article has been published in Forum International. The advantage of body hair follicles are the body hair follicles have the advantages of being a significant additional resource in both numbers and the characters of the follicles. Beard hair is thicker than the scalp hair, giving better illusion of density. The chest hair is although not thick as compared to beard and the scalp, but still, because of the wave and the curl of the hair, it gives a reasonable visual density and careful and certainly better than doing the SMP. Another good quality of hair is pubic hair, provided the patient gives the consent, but certainly pubic hairs are harvested by a FUE technique only. Post-transplant course of body hair, we know the characteristics of body hairs are different. So, the study done by Kim Hong and Lee, he said when the body hair is implanted on the scalp, the hair shaft thickness remains the same, means they remain unchanged, but the length and the hair growth changes and hair becomes longer and they grow faster as compared to from where they were taken. The prerequisite of combination graftings are the patient must have the enough body hair. The most common and preferred area for harvesting are beard, chest and the abdomen. The patient with history of keloid and or hypertrophic scar shall become subjected with caution. A trial extraction of few grafts should be done in such cases. The patient needs to be informed about the risk of hypo and hyperpigmentation. Surgeon and his team must have expertise in body hair harvesting and the best quality of sharp punch should be used, preferably of smaller caliber like 0.7 mm to 0.8 mm are better. I personally use ultra sharp coal punch of 0.75 mm, and for chest and abdomen I also sometimes use 0.8 mm ultra sharp coal. Now the indication for scalp and the body hair follicle combination grafting. Young patient presenting with higher grade of baldness means grade 4 and above. I consider grade 4 and above. Young patient with a strong family history of advanced grade of baldness in first degree relative means the category is aggressive. Baldness category is the patient presenting at younger age group, high grade of baldness, and they have their first relative baldness. So they lies in the category of aggressive baldness category, and there are more chances for them to go in higher grade of baldness. Patient with family history of baldness who are seeking high density for partial baldness at a young age. Many times nowadays, the peoples are more aware of their look. In that case, they younger patient, even at the age of 20 and 25, they are coming and they are asking for more density. In such cases, also the body hair can be used. The patient whose scalp donor density is relatively low with thinner diameter of hair. Patient with higher grade baldness and or likelihood of developing higher grade of baldness who are not willing or who cannot take medical treatment, especially the finasteride. We know people go and check everything on internet, and their incomplete knowledge makes them worry about taking the finasteride and even the minoxidil, and they usually in many of the cases they refuse to take any medical treatment, as such patients are likely to develop higher grade of baldness early. So they are the patients who can be subjected, in which you can use the body hair follicle. Now, the contraindication of combination grafting are the patient are not willing to undergo body hair harvesting, patient with a strong tendency of keloid and pigmentation problem, surgeon's lack of competence in body hair harvesting. Now, the technique is combination grafting of scalp and the body hair can be done in two ways, means two category we can divide. One category is as an adjuvant, means patient has already undergone some transplant and we want to put more hair, so it said this is the category of as an adjuvant or as a secondary procedure. And second category is as a combination as the primary procedure, means you have planned, you think, you foresee the demand in the future, and during primary hair transplant procedure the combination grafting can be chosen. Now first we go for first category, that is as an adjuvant, means a secondary procedure. The body hair follicles are implanted to an area of scalp previously transplanted with scalp hair, and this is the to improve the density, means the more fullness. The indication for combination as an adjuvant as secondary procedure are patient who had a previous scalp hair transplant but wants more fullness. Patients with too much scalp showing through their scalp and the scalp donor area is not sufficient to cover the required bald area. So the planning is, let's go one by one. Augmentation of anterior hairline and the temporal angle. It is preferable to use scalp hair with or without chest and abdomen hair because of the similarity of hair shaft thickness and the character. If the scalp donor area is already exhausted, then donor hair follicles from the chest are best suited. Care has to be taken during the implantation to orient the curve of the hair in a uniform direction towards rather than away from the scalp. This is very important that the curvature of the hair should be taken care. For augmentation of forelock and the mid scalp, beard hair follicles are the best choice, and the chest hair or abdomen hair can also be used. For the vertex area, if the vertex was not covered in prior hair transplantation, then use combination of scalp, chest, and beard. But if already covered vertex previously by scalp hair, in that case you can use beard, chest, or abdomen hair. If the vertex was transplanted previously, as I said, then the beard and or follicles from any other body donor area can be used to augment the density, but it's important that you do not implant body hair in one area. Try to distribute homogeneously to give a natural look. This is the case who has already undergone 4 times hair transplant, still you can see significant scalp show. So we plan to take the body hair because his scalp donor area was already exhausted and it was not possible to extract even the 100 graft for the 100 or 200 graft which we wanted to put in the temple. So we decided to harvest from beard, chest and the abdomen, and more in 2 days and more than 3,500 grafts were implanted. This is the implantation done in anti-hairline, temple area, mid-scalp and also in the crown. And now you can see the scalp show has significantly reduced, but in the crown area, if he wishes, he can go for more hair transplant or he can go for even the scalp micropigmentation. Another case, he has already undergone FUT procedure, but hair characteristics were thin. He wasn't happy. Diffuse pattern of hair loss. We plan to put the hair 6,045 grafts from the scalp and also in the beard was done for 2 days, and now reasonable coverage. Scalp show has significantly reduced and he looks happy. Then the combination of scalp and the body hair means as a primary procedure. In this category, body hair follicles are used along with the scalp hair follicle during the primary procedure. Advantages are we can make a master plan to cover the entire bald and the future balding area. The proper mixing of body hair with scalp hair follicles can be done to prevent an unnatural look. The scalp hair follicles are preserved for future use in aesthetically important area such as to augment the anti-hairline and the temple area. The young patient with positive genetic history, whatever stage they present, but they are likely to develop the Norwood stage 7 in the future. Body hair follicles growth is androgen dependent, and very often younger ones are refusing to take finasteride and even other medications. So higher chances of early miniaturization. Beard hair are thicker and curly, so along with the scalp hair increases the visual density and gives a bounce to the implanted hair. So the technical details of combination grafting means the primary is all cases of Norwood pattern of alopecia means stage 4 and above are examined, evaluated for donor availability of scalp and other body area. Detailed discussion is done with the patients and their relatives. Sometimes it is also important if patient is younger, and then explain them the combination approach of implantation if they agree. First, the scalp hair follicles are harvested either by FUT or FUE depending on the patient's or the surgeon's choice. Then the scalp donor hair follicles are implanted as per the scheme shown in the figure, leaving the gap in between the scalp grafts for body hair follicle. Like whatever your calculation was, you implant harvest scalp hair, then implant all the scalp hair, leaving the gap in between the scalp hair graft. Means you make the slits, total number of slits, then you harvest the scalp, implant the scalp. The complete hairline, transition zone, micro and macro regularities, like this is the anti-hairline zone, and defined zone is reconstructed only and only by using the scalp hair follicles as per the standard norms of aesthetic line creation. In the foreleg area, few scalp hair follicles are implanted, leaving space for body hair follicle. And in the forelock area later on, scalp and the body hair follicles implantation are a combination of the 2:1 ratio. So that's how it has been done. Means this is the standard planning starting from stage 4, 5, 6 and 7. Entry hairline and temples are recreated only by using the scalp hair. In the rest of the area, combination grafting is done in depending on how many numbers of body hair and how many numbers of scalp hair you are using. But in forelock area, we also put the body hair, some of the body hair in ratio of 2 scalp and 1 body hair. That gives more bounce or fullness in the more aesthetically important forelock area. So this is the master plan. First, you implant scalp, leave the gap in between the scalp hair follicle, and then you harvest the body hair and then implant them. So this is what you can see: the planning, harvesting and implantation of scalp hair in pre-made sleep, then harvesting of body hair and implantation of body hair in between the gaps left, and that's how we complete it in two stages. After implanting all scalp hair follicle, body hair follicles are harvested as I explained just behind the defined zone I already explained. Mid scalp and the crown area, scalp to beard hair follicle ratio is 1:1 or 1:2, and in the crown area I put more body hair and less scalp hair because availability of scalp donor area reduces by the time we reach to cover the vertex. And I realize if you put more beard hair, of course not all alone, along with the scalp hair, they will give better illusion because the beard hair are curly, they are round, so they gives you more fullness in the crown area. On the first day, author usually implant all the scalp hair, and on the second day, beard hair follicles are harvested and implanted. As I said, all the recipient sites are created on day one. As a safety precaution, author means I do not extract from more than two body area on a single day. Otherwise, this may cross the safe limit of anesthetic drug. If the chest hair follicles are excised, it is advisable not to harvest from another body donor area on the same day, as the chest itself is a large donor area needing higher dose of anesthesia. Like I mean to say, if you are planning for this chest hair harvesting, do all alone as a independent procedure. But if you are doing beard, then beard and scalp harvesting can be done on the same day. But I extract chest hair or abdomen hair as all alone procedure. So that's important because these areas are large and you do not get that much number of hair follicle. But area is large and you have to give more anesthesia. And if you join it along with the other area, means you are giving anesthesia to chest, another body area and the scalp area and the recipient area, then certainly this is dangerous. So don't do that. In Norwood stage 4, around 2500 to 3000 grafts are implanted, and out of this 500 to 700 grafts are harvested from beard and the remaining from the scalp donor area. The entire procedure is done on the one day itself. Planning of scalp and beard in stage 5, we usually do 4500 to 5000 grafts, that too in 2 days. In a single harvesting either by FUT or FUE, 2000 to 300 grafts, 3000 grafts from the scalp donor area, and then remaining can be done from beard or chest on the next day. During the implantation grafts of the mixing of the scalp and body hair, the ratio remains the same as we have explained before. That was the master plan. This procedure is done in 2 consecutive days. All scalp hair follicles are implanted on day 1 and then body hair on the day 2. That's how. Now you can see the dots, black dots are multifollicle units of scalp, and empty dots, these dots are the beard, so they have been beautifully incorporated in between the gaps of the scalp. Master plan for Norwood stage 6 and 7. Please listen it more carefully. A detailed master plan of the recipient and donor area is done after discussion with the patient. Total number of hair follicles to be implanted is calculated, and the number of follicles to be harvested from each area in multiple stages is also calculated. As a routine, 6000 to 7000 grafts are needed for stage 6 and 7000 to 9000 grafts for stage 7, depending on donor availability and the patient desire for how many grafts he can afford. Out of this total, 4000 to 5000 grafts from scalp in multiple stages can be harvested, Remaining is harvested from the different body areas. This all is done in multiple stage. Usually multiple stage means we count 2 days stage 1, then we give a gap of 4, 6, 8 months, then the stage 2 again of the 2 days. So Norwood stage 6, as I said, 2 consecutive days, a total of 5,000 grafts harvested for the front and mid scalp area. Out of this 5,000 graft, 2,500 to 3,000 grafts from the scalp area on day 1, then the remaining area means 2,000 beard hair follicle are harvested on the second day and they are implanted in between the gap as I explained. So this is the, and remember that the temple area and anti-hairline zone, this all is reconstructed using only and only the scalp hair. Now with stage 7, we use as explained 7,000 to 9,000 done in multiple stages, and we use in this scalp, beard, chest, and even if possible the abdomen grafts are done. Now this is our guideline. Stage 4, you need total of 2,500 to 3,000, scalp 2,000 to 2,500, body hair 5,000 to 700, one day can be done. Stage 5, 4,000 to 5,000, out of that 2,000 to 3,000 from scalp, remaining from body hair, it is done in 2 days. Then 6,000 to 7,000, out of this 4 to 5,000 from the scalp, remaining from the body area, it is done more than 2 days. Stage 7, 7,000 to 9,000 grafts are needed. Out of this total of 4,500 to 6,000 depending upon the scalp area are harvested from the scalp in multiple stages, and the rest of the deficit is covered by the body hair, and it is done in the more than 2 days. Here are few case studies, few example I am giving. It's a stage 4. We did scalp and body hair. 3,107 grafts were implanted in his area. His looks pretty good. This is another case in which 5,119 grafts, scalp and beard we did in 2 days. This is another case in which the result you can see is 11 month. A total of 4,900 grafts were put, and remember that we tried to put every case and strongly advise them to take the medicine, especially the minoxidil, multivitamin, and if we can afford to take the finasteride also. This is a case, another advanced grade of baldness. He was using the hair patch. He was 63 years of age when he came to us. His scalp hair was not that much, but one good thing was that it's all hair, means the scalp and body hair were curly. So he got finally the good result. We harvested in stage 1 from scalp, 2,353 scalp, 2,004 from beard. First 2 days, then after 4 months, we harvested 930 chest hair on day 1, and on the next day, 1,563 beard hair follicles were again harvested, and you can see he looks good. Conclusion is there is an increasing demand in treating the high grade of baldness for greater coverage and density. The supply of scalp donor hair follicle is limited, and the available donor grafts are not sufficient to cover the higher grade of baldness. Non-scalp donor area from different area of the body such as beard, torso and extremities provide the additional follicles which we need. Improved technique and instrumentation of FUE have made harvesting body hair follicle possible and more successful. The proper distribution and the combination of scalp hair follicles with body hair follicles will add to the final visual density of hair transplant and camouflaging the individual characteristic of body hair follicles. Thank you. Thank you very much.